it is really so important to make sure that you're choosing the right provider. And that doesn't mean just for your labor and your birth, but it starts there. Parenting starts with the first moment that you become pregnant, and you have to start making good decisions right there from the beginning. One of the first decisions you're going to make is, who am I going to see as my provider? Will it be a physician? Will it be a midwife? And then what am I looking for in those providers? I get questions all the time. People will come in after the birth of their baby and they'll say, I went through my labor and I wound up with a C-section, and I really felt like no one gave me enough time, and was there something I could have said during labor to have done something different? And the answer is really no, not really. During labor is not the time to try to take control of the situation. During labor is the time where you really need to let go and trust the people that are around you. The time to take control is during your pregnancy. The time to take control is to make a decision during pregnancy, before you've delivered, if this person is actually in alignment with you, if this person's on the same page as you, starting to ask questions early on in your pregnancy about their methods, about their philosophies regarding birth, and about labor, and are they going to, if you want to walk in labor, or you want to have a drug-free birth, are they aligned with that? How many drug-free births have they done? Those are questions that you want to ask well in advance. And I've had a lot of people say, well, I waited to ask those questions really late into the pregnancy, and then I got really nervous because here I was at 36 or 37 weeks of pregnancy and started asking the important questions, and I wasn't really getting the answers that I wanted. Is it too late to transfer if I'm that far along in the pregnancy? And, when I was a midwife, my answer, ladies would call me on the phone at 37 or 38 weeks and would say, I'm only 2 or 3 weeks away from my due date. Is it too late to transfer? And my next question would be, is the baby out? Because if the baby's not out, well, then it's not too late to transfer. The only time it's too late is once the baby has already delivered. So what I'm trying to say to you is that take a very proactive role in deciding whether this person is on the same page as you. I am a huge advocate of doulas too. So make sure that you've looked into this option, okay? Joe and I had a doula, Mary. Love doulas, okay? Love all doulas. She was with us through our entire birth, and it made the experience just unforgettable. Thank God for her. And, when I was in practice, even as a midwife, that wasn't my job, was to be there to do the doula role. It's a completely different role than a midwife's role. And so it was actually a requirement in the last couple years of my practice that if my patients wanted to deliver with me, they needed to hire a doula so they would get the right kind of care. I knew that was something I could not provide to them. So that's very, very important. The other, types of providers that you want to look into are, picking your pediatrician. This is huge, and especially if you're going to be breastfeeding. If you're breastfeeding, let's say this, chances are the only issues that you'll really be dealing with the whole first year have to do with feeding, okay? And so if you go to a pediatrician that's really not that knowledgeable when it comes to breastfeeding, you're going to have issues every step of the way. You've got to remember that pediatricians are not necessarily the experts in breastfeeding. They haven't received very much formal education when it comes to breastfeeding, and the best pediatricians I have met out there, the very best ones, are the ones that say, you have a breastfeeding issue, make sure you go see a board-certified lactation consultant. Those are the best ones. The ones that know how to refer you out when you're having issues. If you're having issues with breastfeeding, you definitely want to seek out a lactation consultant, preferably an internationally board-certified lactation consultant, someone who's certified to provide that kind of care. And even among those people, you have to find one that fits for you. Everybody has different personalities. Everybody has different philosophies. I think if I can sum it up for all of it, it's going to come down to, this is your baby, and this is your choice. The type of care that you're looking for is going to come to, do you feel comfortable with this person? Where parents feel conflicted and where parents get stressed out is when their gut is telling them one thing about themselves or their babies, and someone else is telling them something else. And that's where the conflict comes up, and that's where the stress starts. You need to be with someone that you trust so that when they give you an answer, you feel really, really good about it. I have to tell you, I changed pediatricians 4 times. 4 times with my first baby till I found the one that I love. And now I've been with them for almost 9 years, okay? So, you can imagine I had a lot of knowledge walking into a pediatrician's office and just, asking questions and getting answers that I knew weren't really true or that wasn't right. Well, now how do I trust that person's opinion when it comes to other aspects of my child's health care? So very important that you feel comfortable. How you start this would be to ask your friends, talk to other people that you know that have similar philosophies as you. And it may not be your sister. It may not be your best friend. You guys may be completely different in the way that you want to parent your child. Talk to people who have similar philosophies and then try them out, okay? Remember that if you go ahead and when you first start with a provider, you're hiring them. It's an interview process. We tend to not look at our doctors like we're actually hiring them, but that's really what we're doing, just like you would hire anybody to do a job for you. They're doing a job, they're providing a service. And so that interview process is very important to make sure that you're choosing the right one. Once you hire them, then I believe it's a partnership. And at that point, you guys are going to make decisions together and you're going to hopefully be on the same page. And if things do not go well and you've already hired someone and you've decided, well, this is not working out, it's time to find someone new, okay? So don't feel bad about moving on. The worst thing you could do is not move on when you know you should have and end up with an outcome, whether it's for your birth or with your baby, that you didn't want, look back and regret. Okay, so make sure you could make good decisions and be strong about it. All right, I hope that helped. Did anybody have questions about that? You guys talking about you guys are like talking about other stuff here, so I'm gonna move on. Hopefully that was helpful for everybody. I just think that as a midwife myself, my philosophies were very different than a lot of other midwives that I knew. As a lactation consultant, I work very differently than other lactation consultants. I have different methods, and it doesn't work for everybody. What I do doesn't work for everybody, but for the people that it does work for, we fit really well together, and that's super, super important. I'm going to show you something really cute right now, actually, just to show you how simple, it can be. Anybody can be your teacher, and just about anybody can be your lactation consultant. And I wanted to show you something that I filmed with my kids and how wonderful. This is a video of my children, and I want you to hear from them describing to you how you know your baby got enough when they're breastfeeding. All right, Taylor, we got the video?
Dr. Green said he's going to show this at the next pediatrician
Oh, yeah.
convention.
Dr. Green saw this video and said, they know more than a lot of the pediatricians that I know. Go ahead, roll the tape. They'll see what I mean. So here we are. We were filming our vlog this morning, and my children come in, walking in from the park, looking all beautiful with their hair all wonderful from walking around in the sun and playing out on the swing sets. And they said to me, "Mommy, what are you doing?" And I said, "I'm filming for all the mommies and babies out there to teach them some stuff to help them with their new babies." And Jade, who is 8 years old, and this is Talia right here, she's 5. Jade said to me, "Can I help them and teach them something?" I said, "Sure you can." So I said, "What do you want to teach them?" She said, "I want to teach them how they know their baby gets enough when they breastfeed." So in a few minutes, you're going to see Jade teaching you, how do you know your baby got enough when you're breastfeeding?
My mom is a lactation consultant, and she taught me the 4 ways you know that your baby got enough milk. First, your boobies get softer, right, Talia? And second, your baby is sleeping and not fussing, right, Talia? Third, you can hear your baby swallowing, right, Talia? And fourth, your baby is peeing, right, Talia? Thanks.
So what'd you think of that? Okay, so now if a child who's 8 years old can actually teach you how you know your baby got enough, and let me tell you something, I taught her that once. We were sitting in a restaurant, she said to me, "Mommy, how do you know when a baby has enough if they're eating at the boobie? If you can't see the milk going in, how are you gonna know?" And I sat and told her, and I couldn't believe that she actually remembered it. So that was like totally like on the spot, came in and filmed the whole thing. She blows me away. They both blow me away. So see that? If an 8-year-old can learn this, it's very, very simple. Very simple. They're very smart because they were breastfed too, just so that you know that. Let's move on to the questions here. All right, first of all, I've got some really good questions about storage of breast milk, okay? This came from Tamara in Texas, okay? Hi, Tamara, if you're on with us. She asked me, how long can refrigerated or frozen milk that's been warmed back up stay at room temperature before it goes bad? For example, warm frozen milk that's warmed up to feed the baby, and then there's 2 ounces left over. Can it stay at room temperature for later feeding, and if so, for how long? Okay, this is really important. Breast milk storage times, okay? When you defrost frozen milk, it is not the same as using it as fresh milk or milk that's from the refrigerator. Once you've thawed frozen milk, it takes on a different timing, and that means that it can be out at room temperature for up to only 1 hour. Then it needs to be thrown away. You can't put it back in the refrigerator after it's been sitting out for a while. So, I think that if you were to warm it up and then leave it out, you're going to have to throw it out. So don't defrost too much milk. I think that's the key to the point here. When I used to freeze milk, what I would do is I would freeze different size bags or containers of milk. So some 3 ounce, some 2 ounce, some 1 ounce. So that if my baby ate a bottle and still seemed a little hungry, I didn't have to defrost another whole 3 ounce bottle. Okay, because you don't want to waste any of that milk. And if it sits out at room temperature for an hour, you'll have to toss it. It's only good in the refrigerator for about 24 hours after it's been defrosted. So it's nothing like fresh milk, okay? Fresh milk is different. Fresh milk that you pump can actually sit out for up to 8 to 10 hours, okay? So that's a long time. And then go in the refrigerator for almost a whole week. All right, so that's very different than frozen defrosted milk. Be careful with the defrosted milk. Defrosted milk is really for emergency use, and I talk about this a lot in the Breast Pumps and Briefcases audio, where we talk about the fact that, milk that is in the freezer is for emergencies. When you're going back to work and you're pumping, you're going to be pumping fresh milk from the day before to leave for your baby, because freezing and heating can actually kill some of the properties of the breast milk, some of the good properties. So you don't want to do too much to the milk. The less you do to it, the better. It's definitely better than formula, so that in an emergency you'll have it to pull from. But I wouldn't start stocking up, stockpiling. People buy like extra freezers and have like, a whole room filled with extra milk, thinking that's what they'll use for the second half of the year. You're not going to do something like that, okay? Freeze the milk just for emergency. I hope that answers your question. Next question here. Let's see. This one actually has to do with circumcisions and cloth diapering. Good question. This came up actually this week in the store with one of my clients. And this is from Sherwin. Hi, Sherwin from Pennsylvania. Okay. He wants to know, does cloth diapering affect healing of a wound on a newly circumcised newborn? And is there an increased risk of an infection for a newly circumcised newborn using cloth diapers as compared to using disposables? Excellent question. In my opinion, I think there's less of a risk of infection and less of a risk of irritation if you were to use cloth on a newly circumcised baby. Think about what people did 1,000 years ago, okay, when they were circumcised. We have been using cloth forever, okay? The cloth diapers, if they're washed properly and they're using the right detergent without bleaches and enzymes and all the other things that shouldn't be in those detergents, are extremely safe to put onto an open wound and actually preferable. The problem comes in when you're using petroleums on the circumcisions like A&D ointment, okay? So what I would recommend, instead of the A&D, and the A&D is really just to keep it from sticking to the diaper, what I would recommend is the Earth Mama Baby Bottom Balm. And that will, smeared around the circumcision, will actually have calendula in it. There's an herb inside Joe's going to get me some bottom balm. There's calendula inside that bottom balm. And what it can do is help to actually heal the open wound and keep the circumcision from sticking to the diaper. So you'll still have the same effect. This is, okay, here's the bottom balm right here, okay? Earth Mama Bottom Balm, okay? With the calendula in it. And that will help it from sticking to the diaper, and you won't have any of the chemicals actually sitting against an open wound. So I would actually prefer it. It'll also be safe for your cloth diapers because Earth Mama Baby Bottom Balm is safe for cloth diapering. Okay, so for all of you guys who are cloth diapering, yay! I hope you're doing that. And if you're not, learn about it. Okay, we have classes. We teach workshops here. I think we're doing Tuesday night. Tuesday night, we got a huge class workshop coming. We got a packed house on Tuesday. But it is something that I have become very, very passionate about over the last couple of years. If you don't know enough, get some education. Soon we're going to be bringing it to you online. Okay, so watch out for that. We're going to be bringing you some of that education to you out there if you're not able to visit us. On to the next question. Okay, let's see here. At 15 months old, our son has just thrown any kind of nap schedule out the window. How many people can relate to that? Some days he'll nap for 3 hours, others no nap at all. Some days he goes down at 11:30, other times not till 2. Is it possible? Makes it impossible to plan anything because I'm always worried about his naps. Okay, you can hardly go out if you're not napping. Is there anything I could do to get him back on a regular schedule? Okay. One thing that's very, very important to understand about babies and small children is that you have to keep them on more of a regular schedule. Once they hit around 4 or 5 months old, it's very important to start scheduling their naps. Excuse me, not in waiting till they're like passed out tired. Because what will happen is they start to show signs of fatigue, rubbing their eyes, becoming less talkative. All those things are actual signs that tell you the baby is getting sleepy. If you miss that opportunity when your baby is getting drowsy and sleepy, what happens next is they become overtired. And once they hit that overtired stage, they become wired and then they can't sleep. And it is something that is very important for parents to understand, is to make sure that they're putting their children down at regular times when they're showing those early signs of sleepiness, to start getting them on a schedule. Once they hit that overtired, wired state, the adrenaline starts to kick in and all kinds of hormones start shooting through their bodies. Unlike adults, when we're tired, we just crash, right? Kids don't do that. Take it from me. I got a 6 and an 8-year-old, okay? When they're tired, when they've been out all day, when they've been, at a party all day and they're overtired, they don't want to go to sleep. They get overtired, and same with your little ones, okay? So make sure that you start, if the nap time is at 11:30, make sure that you have the child lay down with the baby if you need to, and have them, give them their blanket, rub their back, do whatever you have to do to get them to lay down, not wait for them to actually lay down on their own. They may not do it. They get curious and they want to just be awake. That's my best suggestion. Okay. Next question comes from, let's see. This is from Beth in New Jersey. Hi, Beth, sweetheart. I know who this is. Okay, so now she's asking, my son has horrible eczema, and we've been trying to determine if it's something that I'm eating, but there are so many possible foods it could be. Do you have any advice for how to tell if a food is triggering the eczema? And if so, what can I do to identify the food? This is such a huge question. I have so many kids coming in with eczema. Do you notice how many kids have eczema and skin conditions these days? She says that they've been to the pediatrician and a pediatric dermatologist without any real answers except applying steroid creams, that makes them uncomfortable. And do we have any products that we recommend to combat the itching? Let me say this. So much of the eczema that's out there, I believe, is not from the foods that we're eating, but rather is coming from so many of the toxic exposures that our children are exposed to. So many toxins. We know that a baby in their cord blood, when they're first delivered, right at delivery, they have almost 200 toxins already found in their cord blood. So that they're being exposed to a ton of different toxic chemicals. And then they come out, and what happens is they're exposed to more, whether it's the chemicals in their diapers, which there are hundreds of them, chemicals in the creams that we're using and lotions that we're putting on their skin. And even if those creams say that they're completely organic or they're all natural, you have to be careful because sometimes they can even have there can be something in them that's causing these babies to react. One of the things that Melinda from Earth Mama Angel Baby, she educated me on this recently, was there's a website called cosmeticdatabase.com, and what you can do is you can plug in whatever product you're using, okay, and Joe, can you put that up on the resources page for them, cosmeticdatabase.com, okay? You could plug in whatever product you're using into this database, and it will show you on a rating scale of how safe it is to use on your baby, and you'll be pretty surprised. There are some products on the market that are really, really bad. One of them being Desitin. Okay, it's has one of the most toxic chemicals in it known to man. Okay, it embeds in the baby's brain. It is horrible for your baby. So if you're using Desitin, please stop using that. Look it up on the cosmetic database and you'll see what I'm talking about. But I think that a lot of the eczema is coming from a lot of the toxin exposures that our children are exposed to. We had one baby in one of our cloth diapering classes not too long ago, was covered head to toe in eczema, head to toe. It was horrible. And what happened was we switched her to cloth diapers, and within a week the mom came back into the store in tears, everything had gone away. The eczema had completely cleared up. So obviously there was something in her disposable diaper that she was reacting to, and she was having a full systemic reaction to it, not just a diaper rash. Okay, if you open your baby's diaper and there's redness in areas that are not just right around the butt, but like in all areas where the diaper is touching, in the front, on the sides, that's not diaper rash, okay? That's your baby reacting to the chemical in that diaper. Very, very important to watch out, okay? Excellent. Thank you, Beth. Okay, next question here. Okay. Let's see. My sister-in-law, okay, this one comes from Allison in New Jersey. Okay, oh, I know Allison too. Allison, hi, Allison. Okay, hi, Shari. She says, my sister-in-law is delivering via C-section. Can she still use the breast friend pillow in the hospital? Yes, of course she can. In fact, it's one of the best pillows to use for a C-section, because if you're wearing it right, if you remember and you watch on my video, okay, you're wearing it high up, so it's not actually on your incision. You're wearing it up under your breast, so it shouldn't actually be pushing on your incision. You want to bring this right to the hospital with you and use it immediately after delivery. Maybe the next day, maybe the first day you may be laying down if after a C-section, but after that, yeah, you're going to get up in the chair, you're going to sit up, use the breast friend pillow, and follow the guidelines that I give you on how to breastfeed. Okay? How can she How can she also demand that the eye gel does not go on before she has a chance to breastfeed for the first time if they rush her off her recovery? She's talking about the eye ointment that they put into babies' eyes immediately after delivery, okay? Does everybody know that they put ointment in a baby's eyes? What's happening is they're putting an antibiotic ointment in to prevent against venereal diseases like chlamydia and gonorrhea. And what she needs to ask is this: if she's having a C-section, okay, and the baby is not being born through the vagina where the baby could catch chlamydia or gonorrhea, does the baby even need the eye ointment at all? Okay, the baby's being born into a sterile field. So not only can she request that they delay it till after she breastfeeds, but she should also look into the reasons why they're even doing this type of procedure for her baby and whether it's even needed. Okay, so I would take a look at that. I hope that helps your answer there, okay? So let's move on to some more of our questions and answers. Let's see. There were just so many of them. You guys had so many questions. All right, so once my baby, okay, this came from Barbara in New Jersey, okay, and Barbara wanted to know, once my baby is taking solids, how often should the breast be offered to the baby, okay, and how do you know when to allow the baby to initiate the weaning process? Excellent question. Okay, so Barbara, once the baby's taking solids, you should still offer your baby the breast whenever the baby wants to eat. So if the baby wants to eat, you can still breastfeed before each feeding of solids. But as the baby starts to get a little bit older, into the 7th and 8th month, if you wanted to cut out those feedings and just substitute a meal, like breakfast, like have a meal of food, and then breastfeed in between those feedings, totally fine. By the time my children were about 8 months old, I was feeding them 3 meals a day, breakfast, lunch, and dinner, and I was breastfeeding, I think, maybe 4 or 5 times in a 24-hour period. And your body will adjust to this, so that, I think that was one of the questions that somebody else asked, like, how do I introduce solids and keep my supply up? Your body will naturally keep its own supply. It does not need the same amount of milk as it did in the beginning. Remember, you're making more milk in the first 6 months of the year than you are in the second 6 months, because babies will eat a certain amount of milk, somewhere around 3 to 4, sometimes 5 ounces of breast milk, and never increase from there as the year goes on. What changes is that in the second half of the year, they start to eat solid foods, and so the amount of milk that you're actually producing and feeding decreases that second half of the year, from 6 months to 12 months and beyond, okay? So you don't need to keep up with the supply. Your supply will be adequate for what your baby's taking in, and by nursing more, you'll just make more. All right, I hope that answered your question there. Let's see what else we have here. Okay. Ashley from Indiana. How do I know, how do you know when your baby has eaten enough? Okay, she's asking, and when to switch to the other breast? Usually your baby will tell you, okay? So depending on how old your baby is, what you're going to be doing is listening for swallows, okay? The swallowing sound, babies will suck at the breast to suck, but they suck at the breast to suck and suck at the breast to eat. when they're eating, they'll make a swallowing sound. If the baby's not swallowing anymore, chances are they're not eating anymore, and it's time to switch to the other breast. Okay, so they'll usually either come off themselves, like, eject off the breast and want to switch to the other side, or they're just sucking a lot. You're not hearing a lot of swallowing. That's a really good indication to switch. Let's see. She's also asking, she had issues. Let's see. I may have already done this, she said, but I've been having problems keeping up on my supply because of stress. I've been using a supplement from the health food store since yesterday. It's probably not working yet, but is that enough? That and drinking lots of water and nursing frequently, do you think it's enough? It's the same thing that happened when I tried breastfeeding my first son. My milk just went away out of nowhere. Ashley, are you online with me right now? I see. Yes, I see you there. Ashley Doodle. Okay.
We're literally getting...
Okay, I can't pump hardly anything, and he's, oh, okay. All right, so how old is your baby, Ashley? I need to know how old the baby is. Ashley. Haha, let's see. They're shy. 7 months old. Okay, so Ashley, very good chance that your baby is going through a growth spurt. Okay, babies have certain growth spurts at different times of the year. And so it is very possible. It is highly unlikely that your milk just dried up. Okay, I also, one reason that you would feel like you have a low milk supply would either be that your baby's gone through a growth spurt and the baby's just needing more milk, so the baby is nursing more, draining the breast more, or maybe the baby's hungry and time to start some solid foods. You've made it to 7 months, hallelujah, great job, and so it is okay to start introducing solid foods to your baby, and your baby may be telling you that they're hungry and want some extra. And the other thing too is that I see that a lot of moms start to get their periods again somewhere around 6 months. If you've gotten your period and you're starting to menstruate again, right before your period, you're going to notice that your milk supply will drop. This is due to a hormone shift that occurs. It's the high estrogen levels that occur naturally during your period that will decrease milk supply for a short period of time. And it usually is not even during your period, but for the days leading up to your period that you'll notice that you may have a low milk supply. And this is a really important point for a lot of moms out there, because what I'm seeing is a lot more people are getting their periods while they're breastfeeding for whatever reason that is. You need to remember, if you're getting your period, you may have a decrease in milk supply at that time. What you can do is just you could try to nurse more frequently and make sure that you stick with your nursing. Frequent nursing will give your baby the same amount of food in the 24-hour period. And Earth Mama Angel Baby makes a great tea called Milkmaid Tea that I would highly recommend drinking. You want to do about 3 or 4 cups a day. Okay, that's going to help to really boost your milk supply. It's just a great thing to take every day to help maintain a good milk supply. And it also helps with fussiness. And I know, Ashley, you had commented here that your baby's a little bit fussy. There are herbs. Mama Melinda's so smart. She has herbs inside her Milkmaid Tea that helps your baby to be less fussy. So if you are having a fussy baby in nursing, try some Milkmaid Tea. Awesome product. Okay.
I made a comment about, yes, I have my period, and yes, it drops, but that's not until 2 weeks from now.
Not until 2 weeks from now. You could be ovulating. It could be a hormone thing that's going on for you. Why don't you have you tried the tea? Try drinking the tea, and you got to drink enough of it, about 3 to 4 cups a day, and see if that helps, because I did notice that you were saying the baby was really fussy too. It could also be a growth spurt. And are you feeding solids? I'm going to move on, but you could answer those questions. Are you feeding solids to the baby? Yeah. Try it again. Try it again. Drink enough. Drink enough. I find that usually when the supplements, whether it's the tea, like Milkmaid Tea or More Milk Plus, or any of these fenugreek supplements are not working for somebody, it's usually because they're not taking enough of it. Okay, so you want to make sure that you're following the directions, but taking it as per directed. And with the teas, you really need to drink several cups a day.
Yes, I'm feeding solids. Yes, More Milk Plus is what I have.
Okay, good. You're feeding solids. Okay, good. The mini, and then somebody just added that the mini pill dropped her supply. Yeah, birth control pills can do that too, for sure. Mini pills are different than the combined pills. Definitely, no matter what you do, don't take a combined estrogen pill, okay, when you're breastfeeding. And that's really, it's not a question here, but I just saw that and I want to make sure that's really clear. I've had that come up several times in classes and consultations. If you are breastfeeding, you may ask your doctor if it's okay to go on birth control pills. And the answer is it's safe for breastfeeding, which it is safe to take while you're breastfeeding. What it's not safe for is your milk supply. and so it will significantly decrease your milk supply. You want to make sure you're taking progesterone only contraception, and for some people even that I would stick to more barrier methods like condoms, that type of thing. Okay. All right, let's get back to some questions because there's still so many that I have to answer here. Okay, there's a question here from Lauren, and Lauren is asking, my son is not taking the left breast when breastfeeding, okay? When I pump my right, my right breast produces 4 times more milk. What should I do? Okay, Lauren, I could totally relate to this, and so many people out there are probably sitting back and saying the same thing. Your breasts are not symmetrical, okay? You could probably tell that just from looking at them that they're not symmetrical, but they're also not symmetrical in the amount of milk that they produce. And for some people, it's more significant than others. Some people have a more dominant side, and it can be really incredibly different. In your case, you're talking about 4 times the amount of milk. What happens is, as your baby starts refusing to feed from one side, and you keep feeding a lot from the other, your breasts will produce milk individually. So one side will obviously start to produce even more milk, and that's the dominant side, while the other side that's less dominant will actually start to involute, we call it, which is to start to dry up. And what you might not notice is that as that side is drying up, the milk will actually change flavor. It will go from a sweet taste to a salty taste. And that will cause your baby to want to reject it even more, okay? That's exactly what happened to me with my first baby. She was 4 months old, and I think I've told you guys this story a million times. But, you know, by 4 months old, she totally rejected the left side. I made twice as much on the right side and didn't realize that what had happened because of not nursing, the milk changed flavor, and of course she didn't want it. So if you really feel like you need to keep that side going, what I would recommend is pumping to keep it going. Try to get the milk supply back up with pumping, because your baby probably will not go back to it for nursing till you get your supply back on that side. Some people just let it go altogether. I've had people with severe breast infections that keep reoccurring on one side, and we actually let one side go while we just nurse on the other side. Remember, and Janet, if you're out there, you can tell them you only need one breast to feed one baby, right? Crazy mama twins, you got 2. You're feeding 1 on each side. I love the question somebody asked Janet, Crazy Mama Twins, the other day, and she was feeding her baby, and the person said to her, is she ready for the other side? And her answer was, there is no other side, huh? The other one's for the other kid. Cracked me up. This is from Amanda, I think. Amanda from New York. She is planning on breastfeeding her second baby who's due in February. Congratulations, Amanda. She pumped a little bit with her daughter, but she only had a manual pump, and that's a pump that you would use your hand to move. It has no electricity, but she's a stay-at-home mom. Would I suggest investing or renting in an electric pump instead? She got to the point where she couldn't pump anymore and would only get 1 to 2 ounces out with the manual. That's pretty typical. But if she latched on, she would get much more out, and then the baby would be satisfied. She wants to use a bottle a little bit more this time to free herself up, because she does have a daughter, and to have her daughter and her husband more involved so they can feed the baby too. Okay, so that's a really good question. I guess, you know, for some people, manual pumps, they work great. You know, I even have people who say, I don't need a pump at all. I can hand express right into a cup. Okay, I don't know. That was not me. And if you can't do that, don't worry. There's nothing wrong with you. I think it's a small percentage of people who can actually just manually express. And a manual pump, I don't know. I think I'd get carpal tunnel from sitting there trying to squeeze the thing 1,000 times at a certain beats per minute. It's great if you're trying to save money. And if you really do have a financial issue, and this is the reason that you're doing it, then that may be one reason to use a manual pump. But you also have to look at the cost of your time, the cost of, you know, the fact that you're breastfeeding at all is saving you money by not using formula. Investing in an electric pump is probably the way to go if you want to be more efficient in getting the milk out, even if you're a stay-at-home mom. So a trick to soothe your 4-month-old, your old tricks are not working. Remember, Andrea, I told you that once they hit that 3-month stage, they turn into little personalities at that point, okay? What's happening now that you're seeing is that you are experiencing your child's personality, which can be different than those reflexes that I taught you way back that work for the first 3 months. I would say that if you have a fussy baby, really try to take a look and see if the baby's overtired. Okay, that's really where the first thing to look at. Scheduling naps, having quiet times, making sure you're not letting the baby go too long just because you're out shopping, or delaying their naps is a very, very bad idea at that time. Make sure your baby is well rested. They can never catch up on the sleep that they lose. And what happens is, over time, they found through research that lost sleep in infancy and early baby time can lead to cognitive problems later on in life, and ADD, and all kinds of other sleep issues. So it's important that the baby's getting enough sleep. Look for cues of drowsiness, not till the baby's hysterical crying to try to put them down. Okay, so that's I guess one tip I could give you. Jacqueline, and she in New Jersey, wants to know, if her baby falls asleep on his stomach, should I flip him over on his back? Yes, Jacqueline, absolutely. We don't want babies sleeping on their stomachs, okay? And that's a real big SIDS no-no, okay, is to have your baby falling asleep on his stomach. If the baby's sleeping on top of you on his stomach, that's fine, okay? But you don't want to put your baby down to sleep on their stomach. And if they do fall asleep for whatever reason while they're that way, you should absolutely flip them over onto their back, okay? Last week's episode was all about swaddling. If your baby is under 3-4 months old, you're going to be swaddling your baby and then sleeping on their back, or making sure that they're not flipping onto their stomach, okay? So yeah, no stomach sleeping, no stomach sleeping. And everybody else, see you on Monday. Mwah. Good night, everyone.